So Dr. Eswaran, we've talked about making a confident diagnosis and what are the symptoms and some of the alarm signs and other conditions that can look like IBS. So at the end of the day, what are some of the most important tests that somebody needs to have done to make a diagnosis of IBS confidently and make sure it's not something else?
Yeah, I think that's a very common question I get from a lot of my patients is how do I know that this is what I really have? And so the way I approach at making this diagnosis is essentially talking to the patient, listening to their symptoms, figuring out what their history is, and if they have, really chronic long-term symptoms and they meet the criteria of abdominal pain and change in their bowels, then really you don't often need a lot of testing. Meeting that criteria and then evaluating and ruling out very select other diseases that often mimic irritable bowel syndrome is how I generally approach it. So the tests I offer patients really depends on what kind of history and symptoms they're describing. So for example, if they generally have a lot of diarrhea or IBSD, I'm often screening for celiac disease, anemia, inflammation in the blood, inflammation in the stool, and sometimes even for infection. And based on that, if those are normal, I can often give them a confident diagnosis of irritable bowel syndrome. There's always more testing that we can do if symptoms, don't necessarily respond to the treatment that we're offering, but that's generally kind of the first line. If they have constipation, sometimes we don't necessarily have to do any additional testing, but I often will screen for celiac disease in those patients as well. And sometimes additional testing depending on what medication they've tried. But in general, we're not offering a lot of testing if none of those quote unquote alarm symptoms that we discussed earlier are present. Again, if a patient isn't responding to the treatment as expected that we'll discuss, maybe sometimes that's a time where we have to go back and really think about if there was anything that was missed. But generally in the beginning, it's a symptom-based diagnosis with very well-defined criteria. And so evaluating and ruling out for a select number of other diseases that often mimic IBS is the general rule.